to They Call Me Suki. I'm Suki. I just wanted to get on again. Today is May 9th, Friday, and I'm recording this video for next week because I will be out of town the whole week. So I won't be able to do a video regarding my progress with my business. But what I wanted to do today is to give you an update on my ACDF surgery, 9 months post-op. I actually saw the doctor today. That's the reason why I wanted to do the video today before I forget some things. So when I went to the doctor today, they did a lot of x-rays. They wanted to check out my alignment in my entire spine. They did x-rays on my cervical spine. They also did x-rays on my low back because I continue to have the low back pain. So the low back does have some compression on one of the spines. I said spines, but a piece of the spine. I don't know what the numbers are. I think it's L something and S something, but it's not bad enough for surgery. But what they did find is that there's some arthritis in that area, which can cause the kind of pain that I'm having. Because the pain that I'm having, they said, is not related to like compression of the spine. So that's good news, sort of. But also one of the things that she said I could do that would help the low back pain is exercise, physical therapy, and of course also losing some weight, which I'm working on. So that'll probably be another video because I actually started Zepbound a week ago. So I'll probably do a series on Zepbound and my experience and how it's making me feel, you know. But anyhow, staying on topic of the ACDF surgery. So I got some not so good news regarding my cervical spine. The hardware is intact. Everything looks good. However, there's not any more bone growth than what I had in December. And I am wearing this bone growth stimulator every day for 4 hours. So they want me to wear it longer, but unfortunately, it's set up for only 4 hours. I have to take it off and charge it. So the doctor's going to try and get me a different bone growth stimulator, one that's actually smaller, a newer one that sticks onto the back of my neck, and then it's in a smaller pack that can go in my pocket. And she wants me to wear it all day. So I have to wait for that. And then the other thing is that what she's thinking is because I'm having so many different things going on, like my adrenal gland with the cortisol, different things possibly with hormones and all of that, that it could be inhibiting me from growing bones. So they want me to do a bone density test and then some other kind of bone test to make sure I don't have, I think it's called osteoporosis or something like that. And if some of that is happening, she wants me to see the endocrinologist, which I'm actually already seeing because of the cortisol level. So I've reached out to the endocrinologist. So she said it's a possibility I may need to have some type of treatment with some injections every 3 months that'll help on the inside to help the bones grow because it's 9 months. So there should be more bone growth. But she's saying that I also need a CT scan so that it can tell more if there's more bone than what she's seeing on the x-ray. So she says she hopes she's wrong, and I hope she's wrong too, because my husband is supposed to be home June 30th. We've already started the process of getting him home, but the problem is she says she doesn't recommend it. She doesn't think it would be safe for me to be pulling, lifting, and turning, which I didn't plan to do. So she doesn't think it's safe for me to bring my husband home right now. But I've already started the process because he has called me every day, all day, for like the last month. When am I coming home? I want to come home. I want to come home. And to the point where I have not been sleeping because he calls me all throughout the night. I can't work because he calls me all day. So I just wanted to just bring him home and get it over with so he can come home and stop like going crazy about it. But I may need to go back and ask for an extension for his stay. I don't know if they'll do that because I kind of went a little ballistic on the new social worker because I felt like she was ignoring me, but it ended up that there's a problem with my phone and I wasn't receiving text messages. So anyhow, again, staying on topic. So to summarize it all, I don't want this to be long. It's supposed to be really quick. My 9-month post-op visit today was not the greatest of what I wanted to hear, but not bad. So there should be more bone growth, which I really thought there would, because I am wearing this thing every day, no matter what this is on. And it's bulky. I mean, it literally is like, it's really bulky. This big thing behind my head, this box, it ticks in my ear. So it's a little disappointing that I haven't healed the way that they wanted me to, or they have expected me to. She's actually the nurse practitioner. I keep saying the doctor. She's not the actual surgeon. So the surgeon told me that it was a possibility that it could take a year or more. And then just from my experience with me, for whatever reason, I seem to heal a lot slower than most people. So am I concerned? Slightly concerned, but my trust is in God, so I'm not worried. I'm slightly concerned because, one, I really do want my husband to come home, but I started having second thoughts because I started thinking about caregivers not showing up and everything falling on me, and I'm not in a position to really care for him the way that I was doing, which I shouldn't have been doing then. And not to mention, I also have a hernia, so I can't pull. And then with my neck, she's like, absolutely not. And at least she's increased me to lifting 20 pounds. Before, the restrictions were 5. No, like, over my head for too long. I can do the exercises. That's it. So that's my update. Not healing as fast as they expected or wanted. There's still not a lot of fusion, is what she called it, which is the bone growth, because when they put the titanium in, the bone is supposed to grow over that and cover the metal. So that's my update. So if you're watching this video and you're possibly gonna have ACDF surgery and you're doing your research, I made these videos to give a realistic view of what happened with me for the surgery. So if you want to check out some of the other videos to learn about my symptoms, and then I've done like a few weeks post-op, I've done 3 months, 6 months, and now this is 9-month post-op. And I'll probably do a video in between when I do all of these tests that she wants me to do. And then I'll do a 1 year post-op. And then after that, probably just once a year. So if you are pending this type of surgery, this is what's happening with me. My recovery has been very slow, and in some instances very painful. So that's all I have for you with this update on my 9-month post-op. I will get back to regular scheduled programming next week when I return from my trip with work, and I'll give you guys an update on my 3rd and 4th week in my journey to reinvent my life and my business. So check out those videos too. So again, I'll see you in the next video. My time is up. I thank you for yours. Have a wonderful day. See you next week.